Hi, I'm Stephanie, and I'm a home dialysis nurse at Baylor Scott & White in Temple, and this video is part of the education that we do for patients who are facing dialysis. According to Medicare and ESRD network rules, patients are required to be educated on the different types of dialysis that are available to them, the different treatment modalities, and they are supposed to be educated yearly on these different modalities so that they can choose a modality that fits into their lifestyle and one that makes them feel better. There's a patient education video that we show our patients, and it is at www.pdempowers.com. Again, www.pdempowers.com. And it's about 45 minutes by the time you watch all the little segmented videos, and it gives a really good explanation on what the different types of dialysis are and how it fits into everyday lives for the patients. So, in case you don't know, dialysis is a treatment for kidney failure. If you don't know, kidneys are organs inside of your body that do a couple of things. One of the things that they do is they filter your blood and they remove toxins. The next thing that it does is it removes excess fluid that's in your body, and then you urinate it out. For patients that have kidney failure, it's unable to do this, and it can cause toxins to build up in their body, as well as extra fluid, which can cause a lot of problems. Potassium is a big one that builds up. Too much or too little potassium can cause lots of problems with muscles, and it can also cause your heart to stop beating. And then with the fluid, the excess fluid, for a patient who has high blood pressure or who has any kind of heart problems, a lot of fluid built up in their system just isn't good for their heart at all. It can put them into congestive heart failure. So we teach our patients, there are 5 treatments that are available for them. The first one is in-center hemodialysis, and this is a process where they come to an outpatient clinic and they are hooked up to a dialysis machine. They are usually hooked up for about 4 hours, and their blood is accessed either via a catheter or a fistula or a graft, and the blood is taken out of the body, and it goes through a filter through osmosis and diffusion. The filter cleans the blood, and then the clean blood is then put back into the patient, and it happens like simultaneously, so they're not without their blood for very long. As soon as it's pulling it out, it's putting the new blood back in. This process, again, takes about 4 hours. Doctors can change the prescription according to how clean a patient's blood is getting. Sometimes smaller patients, especially like smaller women, can run less time. They can run like 3.5 hours. And then your bigger, stockier guys, typically, they need a longer prescription, so about 4.5 to 5 hours. You also have to factor in the 4 hours. The 3 to 5 hours, that is just them being hooked up to the machine. That does not include wait time to get back into their chair once they arrive to the clinic, or for the time for them to get off of the machine. They have to hold their sites until they stop bleeding, and then they have to wait for transportation to come pick them up. So typically, we tell our patients that they can expect anywhere from 6 hours. They'll anticipate on in-center dialysis 3 times a week. So that's a total of 18 hours. Since it's only 4 hours 3 times a week, average 4 hours 3 times a week, a lot of times patients feel really bad at the end of their dialysis treatment because we're having to do in such a short amount of time what the normal kidney does 24 hours a day, 7 days a week. The second option is peritoneal dialysis, and that entails a peritoneal catheter. Usually it's inserted into the lower abdomen, either on the right or the left side. They are referred to a surgeon who performs this. It's a surgery that they have to have the peritoneal dialysis catheter placed, but it just kind of it sits in the peritoneal membrane. The peritoneal cavity, and the peritoneal membrane acts as a dialyzer. So we fill the patient with a high concentration sugar solution, and then that solution just dwells inside the peritoneal cavity, and after a certain amount of time, we drain the fluid that's in there, and with the fluid comes toxins and extra fluid. Peritoneal dialysis is typically done every single night. Usually patients are on peritoneal dialysis for about 10 hours. We do have some patients, it just depends on their prescription and what the doctor has prescribed for them, but some can go as low as 8 and some as high as 12 hours a night. They can They don't have to be laying in their bed the whole time. There's extra cords that they can walk around their house. They can sit in the living room. They just have to be connected to the machine it has to be doing the cycles. The patient can sleep and never know that the dialysis is happening. It's really safe and gentle on the body. And so patients that are connected, there's no concern about them dropping blood pressure. It shouldn't make them feel bad. It shouldn't make them cramp or have nausea or vomiting. In-center dialysis typically can cause some of those symptoms. The third type of dialysis option that's available is home hemodialysis. And this is basically the same thing that's done through in-center dialysis. A patient needs an access, either a catheter in their chest, central venous catheter, or a fistula or a graft in their arm. They have to have a care partner. So with peritoneal dialysis, there's no care partner needed as long as the patient can make their own connections. We teach them how to set up their machine and all that good stuff. But with home hemo, they have to have a care partner because one of the side effects of hemodialysis is it can make your blood pressure low. And we don't want a patient to drop their blood pressure and nobody be around to help revive them or resuscitate them in case anything were to happen. A lot of times the care partner is the one that's learning how to access the fistula or the graft. So it's a family member, a wife, a husband, a daughter that is performing the patient's dialysis at home. The next treatment option is kidney transplant. And kidney transplant sounds wonderful. We have a lot of patients that want to do kidney transplant. But according to the Living Donor Network, there's about 93,000 people on the list for a kidney transplant. And it usually takes, according to them, it usually takes about 5 years to get a transplant once you're on the list. Some patients, that wait can go up to 10 years. It depends on some underlying conditions that they have, their disease processes, all that stuff. And then the fifth option is no treatment at all. And without treatment, the toxins continue to build up in the body, the fluid continues to build up in the body, and a patient will eventually pass away from kidney failure. Just a few statistics. There are, according to the United States Renal Data Services, they do a survey every year that talks about the different types of dialysis and how many patients are doing what type. And so for this past year, there were 444,449 patients who are receiving dialysis. Of those patients, about 49,227 patients were receiving peritoneal dialysis treatments, and around 8,444 patients were receiving home hemodialysis. So we just arm our patients with all of this information. We cannot be biased one way or the other and say which treatment is best for them. They have to get all their knowledge, read the videos. We encourage them to look on the internet. Baxter is a really good place to get information. And I think you can just go to baxter.com, and also nextstage.com has a lot of really good information about home dialysis especially, but peritoneal dialysis and home hemodialysis. I hope you learned something from my presentation, and thank you for watching.